Today, we're diving into a really wild medical case. It starts with a super common problem, but it takes this bizarre, almost terrifying turn, creating a puzzle that had doctors scratching their heads. So, just imagine this for a second. You're at work, you get a sharp pain in your neck. We've all been there, right? But what if that pain morphed into something else? What if it actually caused your shoulder to start shaking, totally on its own, and you couldn't stop it? Well, for a 46-year-old delivery driver, this wasn't just some weird thought experiment. This was his reality. One day, on the job, his body just started moving in a way that he couldn't explain or control at all. And the pain, it was described as intractable. We're talking a 10 out of 10 on the pain scale. I mean, that is the absolute highest level possible. A pain so intense, it basically shuts you down completely. Okay, so let's back up. How in the world did a normal strain from a workday spiral into something so extreme, so debilitating? So it all started with that sudden, sharp neck pain at work. But instead of getting better, it just got worse, becoming constant. And then, about 5 days in, the really alarming symptoms showed up. This involuntary, twisting tremor in his right shoulder. At the same time, the pain started shooting all the way down his arm. And this all happened so fast. I mean, in just 10 days, this guy went from being a totally active delivery driver to being completely sidelined by this insane combination of pain and an uncontrollable tremor. You can imagine this rapid explosion of really bizarre symptoms. It was a genuine puzzle for his doctors. They were looking at a true medical mystery. Now, the most obvious culprit seemed to be something called cervical radiculopathy. That's just the fancy medical term for a pinched nerve in your neck. The easiest way to think about it is like a kinked garden hose. The nerve gets squeezed, it messes up the signals, and that usually causes pain, numbness, or some weakness. Pretty straightforward. But here's where the mystery really gets deep. A textbook pinched nerve, yeah, that gives you pain, some tingling, maybe some weakness. But this patient's situation was way more extreme. We're talking off-the-charts pain, an uncontrollable tremor, sky-high blood pressure, even cold hands. None of this fit the typical picture. It just didn't add up. And to make things even more frustrating, the usual first-line treatments did nothing. They give him standard pain meds, things like gabapentin and ibuprofen, but he got zero relief. Absolutely none. The pain and the tremor just kept going, completely unchecked. So with the standard treatments failing, the doctors knew they had to dig deeper. The hunt for the real cause was on, and it was a race against the clock as his condition got worse. You can just see how quickly this escalated. Day 1, he gets this bad neck pain. By day 5, the tremor starts. And by day 10, with the pain now at a full 10 out of 10, he walks into a chiropractic clinic, totally desperate for some answers. And that first visit gave them their first real clue. An x-ray of his neck showed what they call degenerative changes, basic wear and tear, including some bone spurs, especially around the C5 and C6 vertebrae. So this pointed them to a problem area, but it still didn't explain these totally bizarre symptoms. So the x-ray was a good hint, but it wasn't the whole story. To really solve this, they needed a much more powerful tool, something that could finally show them exactly what was going on deep inside his neck. And there it is, the smoking gun. An MRI gave them this perfectly clear picture. You can see it right there where the arrows are pointing. A bone spur, basically an overgrowth of bone, was physically pushing directly onto the C6 nerve root on his right side. And that's the key, right? That physical pressure on the nerve was causing a massive short circuit in his nervous system. See, the C6 nerve helps control the muscles in your shoulder and arm. So when it got squeezed, it just started firing off these chaotic, haywire signals. And that's what created not just the incredible pain, but also those involuntary muscle spasms that became the uncontrollable tremor. Now, to be 100% sure, the doctors did one last test, a nerve block. They injected a local anesthetic right at the spot where the nerve was being pinched. And the result? It was immediate. It was profound. For a little while, all of his symptoms, the pain, the weakness, everything, they just vanished. And the tremor? It stopped. That was the definitive proof they needed. So, with the mystery solved, the focus finally shifted to recovery. And honestly, the path he took to get better was just as surprising as his symptoms were. He went with a conservative treatment plan, starting with daily chiropractic therapy. And get this, after just 1 week, his pain was down enough that he could go back to work. By the second week, he was completely off all pain medication. The therapy was adjusted over the next few weeks, and by the end of it all, he had a complete and, most importantly, lasting resolution of both the pain and the tremor.
I mean, the turnaround was just incredible. He walks in with unbearable 10 out of 10 pain. The nerve block gives him some temporary relief, brings it down to a 7. But after only 1 week of this conservative care, his pain was cut in half, down to a 5. He was finally on the road to a full recovery.
So what can we take away from this one incredible story? What does it teach us about the bigger picture of how we understand pain and the nervous system? Well, the first big lesson is that sometimes really bizarre, atypical symptoms can actually be caused by a pretty simple mechanical problem. It's a huge reminder to look beyond the obvious and to really listen to a patient's symptoms, even if they don't seem to fit the textbook. But here's what makes this case a potential game changer. You have to compare it to the only other similar case that's ever been documented. In that case, the patient also didn't get better with meds, and they ended up needing major spinal fusion surgery. Our delivery driver, though, he had a full recovery with conservative, non-surgical care. And that leaves us with this final, really thought-provoking question. Could non-surgical conservative treatments be a much more powerful tool than we previously thought for these complex neurological issues that start in the spine? This one case suggests that maybe they can, potentially offering a path to recovery that doesn't involve going under the knife.